Hi guys, this is Dr. Priyanka Mehta, gynaecologist and women's health expert from Diva Women's Center, Chennai. Postmenopausal bleeding can be very distressing. Let us first understand what is perimenopause, what is menopause, and what is postmenopausal bleeding. So after the age of 40, there is a period of transition where women can have, because of the changing levels of the hormones, their periods can become little irregular. So either they get scanty periods or periods become heavy. Sometimes periods have a different pattern where they occur only once in 2 or 3 months. So this period which leads up to menopause is called the perimenopause, and it can be as much as from 4 years to even up to 10 years. What is menopause? Menopause is when there are no periods. That means there is no vaginal bleeding for at least 12 consecutive cycles. So 1 year after a woman has stopped her period after the age of 40, that is called menopause. And any bleeding which is happening after menopause is called as postmenopausal bleeding. Now in perimenopause, the bleeding patterns could be very different and irregular. But if your bleeding is happening, say, very frequently, once in 10 days or once in 15 days or even less than 21 days, or you are having bleeding which is very heavy and it goes on for a long time, it's very prolonged, say you have bleeding for 7 days or 10 days or even a month, do meet your gynecologist. However, for postmenopausal bleeding, any bleeding which is happening after menopause, you need to meet your gynecologist immediately. And the reason is, the most concerning reason for postmenopausal bleeding is endometrial cancer. That means cancer of the lining of the uterus or the inside part of the uterus. So if you see here, this is the uterus. We have 2 tubes on the other side, fallopian tubes. These are the ovaries. So this part inside is called the endometrium. And if there is any kind of growth or some problem happening in the endometrium, the first symptom could be postmenopausal bleeding. So 1 in 10 women, which means 10% of women who report postmenopausal bleeding, they could be having an endometrial cancer, which will need to be evaluated. But 90% of the times, the bleeding in the postmenopausal time could be just something like a simple polyp, or sometimes if women are taking any hormonal tablets like HRT, bleeding could be because of that. Or sometimes women take some tablets like anti-cancer drugs for breast cancer, tamoxifen, so even that can cause bleeding. Or it is just bleeding because of atrophy. That means the blood lining inside the uterus is just becoming, because the vessels, the blood vessel there is becoming kind of old, so there is a little bit of bleeding. Or the hormones have come down, so even there can be bleeding from the vagina, and only once you meet your gynecologist and you are evaluated and examination is done, can be found out what is happening. So when there is postmenopausal bleeding and you go to your gynecologist, the first thing that is done is the transvaginal scan. After the examination, a transvaginal scan is done, and with this scan we get to know the lining of the uterus or the endometrial thickness, or if there is any other problem like a polyp or a fibroid or a kind of a growth. So only with the scan we can really identify, and that scan is called a transvaginal scan. If there is a problem in the uterus, in the endometrium, it is thicker than what it should be for your age, then your doctor may suggest something called a endometrial biopsy. And this endometrial biopsy is important because a little bit of tissue is taken from the inside of the uterus, and most women are able to tolerate that, which is done in the outpatient clinic or the OP without much anesthesia. So you will be given a painkiller tablet and that biopsy can be done simply. If, however, you are either not able to tolerate a biopsy in the outpatient, or it is not possible because sometimes it's difficult to take it, then you will be suggested to do a hysteroscopy biopsy. So important thing is that if there is any bleeding or any abnormal discharge or even bloodstained discharge after you have stopped your period for 12 months after the age of 40, to meet your gynecologist and get yourself checked. Thank you, and stay safe and stay healthy.